They told the men they were being treated. They told them the doctors cared. They told them the government was there to help. For 40 years, 600 black men in rural Alabama believed that lie, while the United States Public Health Service watched them go blind, watched their hearts fail, watched them die, and took careful notes. By 1972, at least 128 of them were dead. Not because a cure didn't exist, but because the men running the study had decided these men's lives were worth less than the data. The year is 1932. The place is Macon County, Alabama, one of the poorest counties in the United States. Sharecroppers work land they will never own. Tuberculosis moves through communities unchecked. A trip to the doctor is a luxury most families cannot afford. Into this world, a team of officials from the U.S. Public Health Service arrives. They bring food. They bring medical exams. They bring the promise of care. The men of Macon County have no reason to distrust them. That trust, quiet, reasonable, human, will become the foundation of one of the most deliberate medical atrocities in American history. In the fall of 1932, the U.S. Public Health Service launched what it called the Tuskegee Study of Untreated Syphilis in the Negro Male. That name alone tells you everything and nothing at the same time. Untreated. The word was there in the title from the very beginning. But the men enrolled in the study were never told that. They were told something else entirely. Researchers recruited 399 black men who had already contracted syphilis in its latent stage, meaning the disease had moved deep into the body and was no longer visibly active. They also recruited 201 healthy men as a control group. Together, these 600 men became the subjects of a study that would run without their knowledge or meaningful consent for 40 years. To bring them in, the USPHS used language the men already understood. In rural Alabama, bad blood was a common term, used loosely to describe fatigue, aches, vague illness. The researchers told the men they were being treated for bad blood. They received free physical examinations, free meals on the days they were tested, free transportation to and from the clinic, and critically, free burial insurance. In communities where a proper burial was a financial burden, that promise meant something real. It meant these men mattered. It meant someone was watching out for them. What the men were not told, the actual diagnosis. They were not told they had syphilis. They were not told what the disease could do to the body over time. The nerve damage, the cardiovascular destruction, the way it quietly dismantles a person from the inside. They were not told that the treatments they received, aspirin, vitamins, iron supplements, were placebos, medically useless, designed not to heal, but to maintain the appearance of care while the disease ran its course. The Tuskegee Institute lent its name and facilities to the project. Nurse Eunice Rivers, a black woman trusted by the community, became the study's primary liaison, genuinely believing for years that the men were receiving some form of legitimate care. Her presence made the men feel safe. It made them stay. The study was designed to last 6 months. It lasted 40 years. For the first years of the study, The absence of treatment was, in a narrow and horrifying sense, consistent with the medical options available. There was no reliable cure for syphilis in 1932. Existing treatments were painful, toxic, and only partially effective. The researchers could tell themselves, and perhaps did, that the men were not losing much by being in the study rather than outside it. That argument died in 1947. That year, penicillin became the established standard of care for syphilis. It was cheap, it was effective, it worked. A full course of penicillin could stop the disease entirely, even in its later stages. For the men in Tuskegee, this was the moment everything could have changed. This was the moment the study should have ended. The researchers had data, the disease had progressed, and now there was a cure. The USPHS chose to continue, not by accident, not through bureaucratic confusion, deliberately. The men were actively excluded from receiving penicillin, the drug that was, by then, being administered to syphilis patients across the country. When some participants were drafted during World War II and would have automatically received syphilis screening and treatment through the military, the USPHS intervened. They contacted local draft boards. They had these men removed from treatment lists. They ensured the study would remain clean.
Local physicians in Macon County were quietly informed. Some were recruited to ensure participants would not accidentally receive outside treatment. Nurse Rivers continued her visits, continued building trust, continued driving men to their appointments. Appointments that offered nothing but documentation of their decline. Dr. John Heller, who directed the study during the 1940s and 50s, would later summarize the logic without apparent remorse. The men's status as patients, he suggested, did not warrant ethical debate. They were subjects. The study was the priority. By 1960, over 100 men were dead. The study continued.
What untreated tertiary syphilis does to a human body is not abstract. It is not statistical. It is specific, slow, and irreversible. The Treponema pallidum bacterium, left unchecked for years, moves into the cardiovascular system. It attacks the aorta. It causes aneurysms. It enters the central nervous system, a stage called neurosyphilis, producing dementia, blindness, and loss of motor control. The men in the Tuskegee study experienced all of this. Researchers documented it, measured it, published it. Between 1932 and 1972, the study produced 13 peer-reviewed papers in respected medical journals. These papers were read, cited, and discussed within the medical community. No one who encountered them raised a formal objection. The study was considered, within those circles, to be legitimate science. The men went home after their appointments. They went back to their fields, their families, their lives, deteriorating, and never told why. What they did not know, what no one told them, was that they were infecting the people closest to them. Syphilis is transmitted sexually. Wives contracted the disease.
Children were born with congenital syphilis, a condition that causes bone deformities, neurological damage, and in some cases, death in infancy. The study was not just destroying the men enrolled, it was moving through families. And every case was recorded, every complication logged. Researchers knew
they continued. There is a particular quality to this kind of horror, the horror of the clipboard, of the careful handwriting, of the doctor who nods and makes a note and says nothing. It is not the horror of a single act of violence. It is the horror of a system functioning exactly as intended. These men were not forgotten. They were watched, monitored, used. And when they died, their bodies were autopsied. One final data point in a study they never agreed to be part of. In the files, they were not names. They were case numbers.
In 1966, a man named Peter Buxtun joined the U.S. Public Health Service as a venereal disease investigator. He was not a civil rights activist. He was not looking for a scandal. He was doing his job, reading files, reviewing cases, learning the history of the programs he was now part of. And then he found the Tuskegee study. Buxtun filed a formal internal complaint in 1966. He argued that the study was unethical, that it violated the rights of its participants, and that it needed to stop. The USPHS reviewed his complaint and dismissed it. He filed again in 1968. Again, dismissed. The agency convened a review panel, made up almost entirely of physicians who had been involved in the study, and concluded it should continue to its natural endpoint, which meant until the last man died. Buxtun left the USPHS, but he kept his documents. In 1972, he passed those files to Jean Heller, an investigative journalist with the Associated Press. On July 25, 1972, her story ran on the front pages of newspapers across the United States. Within days, the story was everywhere. Within months, the study was shut down by order of the Department of Health, Education, and Welfare. 40 years. It took a leak to end it. The final accounting was precise and damning. 28 men had died directly from syphilis. At least 100 more died from related complications. 40 wives had been infected. 19 children had been born with congenital syphilis. A class action lawsuit followed. The survivors and families eventually received a $10 million settlement. No individual was ever criminally charged. In 1997, 25 years after the story broke, President Bill Clinton stood in the White House and issued a formal apology. 5 of the study's 8 surviving participants were present. Clinton called it deeply, profoundly, morally wrong. The men in the room were in their 80s and 90s. They had been waiting most of their lives for someone in power to say that. The Tuskegee study did not create medical mistrust in Black communities. It confirmed what many already suspected, that the system was not designed with them in mind. Researchers have since documented a measurable correlation between awareness of Tuskegee and reduced rates of medical engagement among Black men in the United States. It shows up in vaccination data, in clinical trial participation, in the simple act of going to see a doctor. The damage was not contained to Macon County. It was not contained to 1972. It is still here. History books have a way of softening this story. They give it a paragraph, a date, a legislative outcome. The National Research Act of 1974, the Belmont Report, informed consent protocols. These are real reforms, and they matter. But they are also a way of filing the story away, of saying, we learned, we fixed it, move on. The men of Macon County did not get to move on. The ones who survived carried the knowledge of what had been done to them for the rest of their lives. The ones who didn't never knew. That is perhaps the heaviest part of this story. Not the betrayal that was eventually exposed, but the betrayal that most of its victims never lived to see named. This happened. It was documented. It was published. It was known. And for 40 years, no one with the power to stop it chose to do so. Remember that the next time someone tells you that history is past.